Welcome to the HealthspanMD podcast. So we are thrilled to have with us on the HealthspanMD podcast Dr. Ricky Brown, known as the real TikTok doc, double board certified plastic surgeon. He's here in Scottsdale, Arizona, specializes in cosmetic and reconstructive procedures, focus on breast and body surgeries. We are going to talk about his powerful presence on social media, his book, The Real Beauty Bible, and, with this growing ability for people to live longer, to stay healthier, how many of them now want to continue to look as good as they're feeling. Welcome to the HealthspanMD podcast, Dr. Brown.
Thank you. Appreciate you having me.
No, I'm really excited for you to be here. One of the things that really strikes me when I looked over your social media stuff is how relatable you are. And one great example of that is you tell a story about how you went from having a 2.6 GPA to becoming this, amazing plastic surgeon. One, can you tell the story? Because I think it's just so powerful, but also how that's important to you and how you communicate who you are to people out there.
Yeah, look, everyone's got their story, right? Like I try to tell people who message me about starting social media and what should they do. I'm like, you just have to find what your story is. Everyone has one. And mine just so happens to be that at a young age, I wasn't a great student. And I don't think it had anything to do with intelligence. It was mostly just my attention span wasn't there to study, and I didn't enjoy school, and I wanted to play baseball and be outside. And so moving through high school, I always did decent in school. I wasn't flunking out or anything like that, but I just never really had a desire for any profession, even going into college. So when I was in college, I was kind of puttering along, not really knowing what I wanted to do. And my dad, interestingly enough, my parents owned a computer company selling systems to doctors. That was like back in the 80s. My dad was already getting into automating offices and patient scheduling, and it wasn't the EMR that it is today. So I kind of decided maybe I'll just go work for them. Like maybe I'm going to be in the computer business and this is what I'm going to do. So I thought about going to business school. And at that time was when my GPA was like around 2.6 or so. And I was at Georgia. So I'm from Atlanta, and I was at Georgia at the time. And I just kind of had a pushback moment at the table one night studying for economics for an exam. And I was just like, supply and demand curves. This just sucks. Like, this is so boring. There's nothing about any of this stuff that interests me. And I'd always been interested in science and medicine. And I grew up across the street from an OBGYN. And of course, I was around doctors with my parents. So I decided just to take a couple of chemistry classes just to see if it grabbed me. And I got A's in my first 2 chemistry classes. And I didn't tell my parents. I just was like, I'll enroll in these classes alongside to my business classes that I'm taking. And as I started to get drawn towards, wow, maybe something in science is what I want to do, I just kind of decided after volunteering at the hospital that I wanted to go to medical school. So I mapped it all out, drove home to Atlanta, laid it out for my mom and my dad, like what I was wanting to do. And they were like, go for it. You have our full support. My dad was a little worried because I hadn't been such a good student for so long, and he knew what I was up against, right? Like he knew this was not just I'm going to do this thing, which is what it turned out to be. So I decided to just hit the road running and did all my pre-med stuff and mapped it out. And my pre-med advisor told me I'd never get in. And I had like a 3.8 science GPA, and the rest is history. I got in my first year, which was pretty amazing, and there's a story behind that, but that's the general gist of kind of how I ended up trying to go to med school.
Yeah, it's a crazy story, and funny, it reminds me of mine. I barely graduated high school. I had a 2.8 GPA in high school. My first semester in college, a 0.6 GPA. I ended up with a 3.3. How I got into medical school is still a bit of a mystery to me, but when I got there, oh my gosh, I worked hard because I finally put it together. I realized this is what I love. This is I can be good at this if I work at it, and it's turned out okay for both of us. I guess.
I don't think it's at all uncommon story that we hear, right? Like we force kids to know what they want to do for the rest of their life, and that's an impossible thing to know when you have no worldly experience. And so guys like us, once we kind of got interested, and you grabbed onto something that was interesting to you, it was easy for us to succeed. And I was just like you. I had to work 10 times harder than everybody else. Wasn't a great test taker, but I still did just as well.
Yeah, good for you.
Yeah.
What led to you going into plastic surgery?
So I was in general surgery first, and I was doing that in Chicago. My residency was at Mount Sinai, and it was just knife and gun club. It was crazy stuff. And I loved the energy of trauma, but in doing that in an inner city hospital, we didn't have plastics. So plastics used to come in from Northwestern to do some of the reconstructive work that we needed to do for trauma patients. And that combined with, during my third year, some of the residents came over from Northwestern that were plastics residents and were like, hey, you should think about coming in the lab and doing wound research and scarring, and you should think about plastics, and it's such a cool field. And I was at the point where I was so burned out from trauma that I just wanted a non-clinical year.
Right.
So I was like, I'm down. So I went into the lab to do research, and that's kind of where it stimulated my interest in plastics, and actually transferred to Northwestern to finish general surgery, and then ended up getting into plastics from there. So it was the reconstructive stuff is what really grabbed me in the beginning.
Yeah, how interesting. I mean, you know, your residency experience had to be absolutely brutal. I can only imagine. Inner city Chicago.
Yeah, it was pretty crazy. I mean, we were fearless, though. I will tell you, by the time I was a second or third year, I was managing vents and floating swans, and the nurses obviously taught us everything we know in the ICU, but managing drips and putting in lines and chest tubes and all that crazy stuff, so that when we got in the OR, if there was a bleeding risk for us, it was like no big deal.
Right.
Been here, done that, you know?
Yeah.
So yeah, it's pretty crazy.
Yeah, that's awesome. And so you ended up doing finishing your residency at Northwestern. Then is plastic surgery 2 years? Is that right?
It's 3 now, but when I was applying, it was 2. So I did my full general surgery training, and then at that time when you could apply for plastics, it was an extra 2 years. Now it's 3. So they have to do 3 even if they come out of some other residency training program. So for me, yes, I did 2 more, and that was in Omaha, Nebraska.
So plastic surgery, commonly think about this as you have the science, of course, you have to know how to operate and be a doctor, but there's an art to that as well. Is that something you've always had as part of your interest?
No, I mean, I can't draw to save my life, so it's nothing like that.
Okay.
But I will say that I have a really good eye for what looks good and what doesn't look good. And I think that sort of played into my breast cancer reconstructive phase of my career, as well as the cosmetic stuff I do. And I kind of jokingly tell people, like, it doesn't matter if it's reconstructive or cosmetic. Everything we do is cosmetic. We're trying to make things look the best we can, no matter what we do, right? So I think just appreciating anatomy and seeing things over and over and doing things over and over, and sort of, crafting, honing in the craft of my technique has led me to what I think are good results. But I wouldn't say I'm very artistic, but I just have a good eye for what I think looks right.
Yeah. Yeah. I also want to talk about a book. You're an author as well, on top of everything. Let's see. We got father, we had husband, we had plastic surgeon, the real TikTok doc, the Real Beauty Bible. What led you to writing that book?
So that got manifested because I'd always kind of thought it'd be cool to write a book. I just didn't know how I was going to work that in. And I sort of started getting into social media and seeing a lot of the botched surgery and a lot of the stuff that people were falling into that bothered me. And I was like, man, people need a guide. They need a book, like, of what to think about before surgery. What are all from financial to talking to your family about wanting to have a procedure done to, what are the procedures that are available to me? And then the last part of the book is more about, here's exactly what it's going to feel like the day of surgery. I'm going to walk you through the process, and then I'm going to sort of talk about how you're going to live in your new body. So I got very disenchanted with people not really having a resource to go to just read it. That was easy to go, oh my gosh, okay, like if I want to get involved in this, these are the things I need to think about, and here's how I would do it, and here's how I could find a surgeon. And so that's where it all started, was I just decided it was time, and I stumbled upon a group that was kind of helping me in my practice business-wise, knew a company that could kind of help you write books. And so I jumped on that and said, hey, this is my chance, and I'm just going to start writing, and working with them, and the rest is
What a
history.
great service. So this is basically what you end up walking people through before your surgery.
Yeah.
You decided to put it in a book.
It's almost like a consultation, it's a lot of the things that people should be thinking about. And, I talk about stuff. It's kind of cool that we're chatting because I talk about nutrition and health and wellness, and that plastic surgery, cosmetic stuff should be your last resort. You should be thinking about all these other things first. So I try to walk people through that too. Like, hey, have you maximized your lifestyle? Are you at a place where you're ready to even have a good result if you have a cosmetic procedure or reconstructive? So that's really important to me for people to understand that.
Yeah, I wanted to touch on that because I get that sense from looking at your website and our discussions as well, is that you really do have a holistic approach to this. You don't look at it as just, I have a scalpel and that's that's my tool. There are other ways. How do you incorporate that into your discussions with patients? I mean, is there times when you're like, okay, look, you need to fix these issues first, and how do you make those decisions?
Yeah, 100%. I turn people away all the time. I think that the sensationalized stuff that we see on social media is what most of the world perceives for all of us plastic surgeons, is that we all do this bizarre, crazy surgery that will say yes to everybody, and that's just how we all are, and that couldn't be further from the truth. I know I'm not the only one that feels this way, but we're rare. I truthfully, when I see a patient for, let's just say, a tummy tuck, I'm looking at them and we're having this conversation about, one of the things I ask them right away is, where are you on your health and wellness journey? Are you happy where you are? Are you trying to lose weight? Are you struggling to lose weight? And once I get a sense of that, we have that discussion. And if I recognize that, hey, you have a lot of visceral fat, and for those of you who don't know what that is, that's the fat that we carry around our organs. It's the fat that actually is not good for us, really bad, leading to metabolic syndrome and other things. If I recognize that they're bulging from that, I tell them there's nothing that I can do surgically to make your stomach flat. And until we address the issue of you potentially losing more weight, and this isn't a fat versus skinny issue, it's I want to give you the best result possible. Until we handle that, I don't think it's worth you spending whatever it is you're going to spend for me to do a procedure that you're going to be half-assed kind of happy with.
Oh, I never thought about that before, but you're exactly right. Like, one of the things that was really revolutionary for me in my practice of preventing disease is understanding visceral fat and as a marker of metabolic disease. And, when we got a DEXA scan for body composition,
I love those things.
It's so powerful.
They're the best.
Like, I sometimes I'm like, how did I manage patients before?
I know.
Without knowing their muscle mass, their visceral fat, and then also to be able to show them, the improvements with that has just been such a great tool for us.
It's amazing. I mean, on my own health and wellness journey, when I got out of residency, I was 200 pounds and overweight, and my wife was pregnant with the twins, and I'd always been a pretty healthy guy, and so I used DEXA as part of my initial screening. Like, let me screen myself. Now I'm going to go get healthy and start losing weight. And just watching the muscle mass go up and the fat mass go down and the visceral fat go down, it's pretty compelling, and it's better than anything that we could do. All these machines in the gyms where you hold it with your hand, I'm like, I try to tell people, that's not what you need. That's not really that efficient or accurate, but the DEXA is pretty sweet.
Yeah, we had one of those impedance devices in our office. It was the one where it did pretty good measurements. It was called a Fit 3D, and you rotated. So the measurements were really great, but the body fat percentages with using the impedance device, it was just so variable.
Yeah.
I had days where my body fat percentage would change 4% in one day. So I ended up donating that to Banner University, and we got the DEXA because it was so much more
I need to scan
helpful.
myself, so I'll have to come by.
Well, anytime. It's right there. So anytime you want to. Well, that's one of the things I wanted to ask you about, because you're clearly in really good shape. Like, that's something that's important to you. You're very muscular and fit. How did you do that? I mean, that's not an easy thing. As I went through this in medical school as well. Like, we're just trying to survive.
Yeah.
Medical school, residency. It was really after I became an attending physician that I started recognize, okay, I got to get my act together.
Yeah.
Could you share your story?
Yeah. I mean, what happened for me was, so when I got out of training, I just decided it's time to lose weight. And just like probably most other people out there, I was trying Weight Watchers and Medifast and all these different things. Weight Watchers was good because I didn't realize it, but now I realize in hindsight, I was basically counting calories and learning how
Right.
to
They
sort
make
of
it easier.
create a calorie deficit. So I started losing weight, and what happened was I got so skinny and had no muscle mass, and that was also an unhealthy place to be, right? So when
Right.
I was heavy, it was unhealthy, and when I was too light with no muscle mass, it was unhealthy. And I just happened to stumble across a friend of mine who was doing CrossFit. And even though that's a bad word for most people, it's been great for me. And so I've been doing it for 12 years. So I went over to their gym where they were doing CrossFit. And I remember going in one night to watch them do one of the workouts. And as soon as I walked in, like after 5 minutes, I was like, oh yeah, I'm doing this. And what I loved about it was it combined, because I was athletic growing up and into athletics. It combined weightlifting with cardio and the resistance training and just the competitive aspect of it where you're sort of competing with people around you.
Right.
That's what grabbed me. And honestly, I just showed up 4 to 5 days a week, did what they told me to do, left and went home and ate well, and that's all I did.
Yeah.
And so I've been doing that for many years. And of course, as I've gotten older, I'm 54 now, I stay within myself in there. I still lift pretty heavy, but with good form. And I only go about 3 days a week, and I do jujitsu a few days a week, and we hike, and we're outdoorsy type people. But for me, it took me the better part of, and I think this is good for people to hear, it took the better part of 6 to 7, if not 8 years for me to figure my body out, what meal plans worked best for me, what ratio of different types of working out worked for me. And I think that's something that's important for people to know is it doesn't just happen overnight. It takes a while.
It's a journey, isn't it? Like I think about that a lot when I, longevity, that word can have different connotations to different people. I think of it as exceptional healthcare that gets results, and that takes time, because things are changing. You're changing, your health's changing, the knowledge is changing, the insights are changing. And I don't know, and I'm guessing you have the same. Somebody comes in and says, well, what diet should I follow? I have no idea, right?
Yeah, it's hard. I mean, I try to tell people the easy stuff that we all know.
Right.
Cut out the processed foods.
Yeah.
Try to decrease your sugar, your refined sugar intake. And outside of that, I think people just sort of have to experiment with, am I a higher carb, higher fat guy? Am I a lower carb, higher protein guy? Like, who am I? What works for me? But at the end of the day, it's pretty straightforward. I don't want to say weight loss is straightforward because we obviously know that obesity is a disease and it's not easy for everybody. But in general, creating a calorie deficit and staying away from processed foods and not drinking sodas, those are big, easy cuts that people can do that if they can be consistent with that, they'll see a drastic change in their body.
We as part of our nutrition, strategy is that's step one is eliminating or minimizing highly processed foods. And it's shocking both how often people will say, oh, I don't eat many highly processed foods. And then they look at their diet and they're shocked. They're just like, oh my gosh, I can't believe how much. Because the food industry has become very good at convincing us that this crap food is not so bad for us. And the other part of this is how many people that one thing is all they needed.
Right.
They don't need to count their carbs or their, fat or anything. What they eliminate the highly processed food or minimize that, and all of a sudden things just start to fall in place.
Yeah, I think tracking your food for a while is very important. I don't think that you should spend a lifelong of counting calories and stuff. But I used MyFitnessPal and I tracked everything that I did for a couple of years, and I'll tell you, it showed me, and I have patients do this, my own patients, when they tell me that they're eating well and healthy, and I'm okay, go track it. I want you to be honest with everything that you put in your mouth. You put it in MyFitnessPal, and they would come back and be like, oh my God, I'm eating like 5,000 calories a day.
Yeah.
This is insane. And so when you start to track it for a little while, you just get a better sense of, wow, I thought I was eating healthy, but I'm just taking in too much.
Well, it's the environment. We have so much food available to us all over, and it's easy to fall into that habit of, snacking here, snacking there, and you're just not, your brain adapts to it. That's not really paying that much attention.
Yeah.
What are the procedures that you do or people come to you most frequently for?
So I do all breast and body. I don't do any face anymore except for upper blephs. I'll do some upper eyelids in the office. But mostly what I do is breast and body procedures. So of the cosmetic stuff, it's reductions and mastopexies or breast lifts, breast augmentation, breast lifts, tummy tucks, lipo. I dip my hand still in reconstruction a little bit, but because of the way insurance is and being a solo practitioner, that's really fallen to the wayside for me, because in the long run, I was basically paying insurance companies to do that reconstructive work as a solo guy. So that's the only reason that I sort of have abandoned doing a lot of the reconstructive stuff. But I do a lot of breast and body because it's what I enjoy. Facelifts bore the heck out of me, and that's why I stopped doing them.
Yeah.
But I do some isolated stuff like upper blepharoplasties in the office because they're just easy to do, and I enjoy those.
Right. Yeah, your experience with insurance has been mine as well. Like the environment is so challenging, especially as a small practice, and that's what I found. I was paying people to take good care of them, because the insurance companies weren't doing that. So you don't have any insurance aspect to your practice? No?
Not anymore.
Yeah.
We're still on with some insurance companies, but for the most part, we just don't take it because like you've just identified, it's just tough, right? I think that the public at large looks at our altruism, and we should just be taking care of people, and we should be happy and honored and privileged to be able to take care of people, which we are.
Right.
But they just don't realize that medicine is a business as well, and if you can't make money, you can't keep the lights on. And literally, as you said, we were losing money on insurance cases, and it's not balancing out enough for me to make it worth continuing to do, which is so sad because I enjoy that stuff.
Yeah. No, it's frustrating because I know people are paying a lot of money for their insurance, and they're like, well, I should be getting great care out of this, but it's just not the case. And unfortunately, I that's coming to a head. I mean, we are all reading the headlines, and I'm hoping that this justifiable outrage that people have is going to lead to some material changes in this.
I agree.
Yeah. You talk on your channels and in your book as well as about people's motivation for the procedure and how what is that motivation? It's important that you understand what that is. Can you talk a little bit about what's a motivation that you're like, okay, this is I can help this person, versus one where you're like, boy, I don't know if I'm the right fit for this person.
So I think first, my goal when I meet with patients is to get an understanding of why they're trying to do it, right? The obvious things are easy. I have loose skin and sagging breasts. I cannot exercise that away, right? Or I had 5 kids and I've got extra skin and a bulging abdomen, but I'm pretty fit. You can't exercise that away. And so people just want to feel good in their bodies. And I think that I get so bothered by the comments that are like, why can't you just love yourself the way you are? And when I try to get people to understand, and I can't do it on social media and comments because no one understands, but what I try to convey to people is that just because someone wants to have a procedure doesn't mean that they don't respect themselves or love themselves. You get tattoos, you wash your hair, you do things, you change you change your body because there's something about that you enjoy and like for you.
Right.
It's the same thing for patients who want to have a procedure done. So as long as I understand that people are doing it for the right reason, and I know that they're doing it for themselves, I don't have a problem with it. And it's rare that I get people that I feel like are doing it for someone else. So, but I turn people away. I turn people away because 1, they're not ready, or 2, if I sense that there is maybe a mental health aspect to it that they're not ready for that procedure, then I do try to offer them to get them help to talk to someone, and I'll tell them that now's not the time. It's not a no, but now is not the time.
I can only imagine those are challenging conversations to have.
They are, but I'm such a keep it real guy, and I'm not mean about it.
Right.
And I think once I explain to people the reasons why,
because you care.
I'm
right?
saying you're not a good candidate because
Right.
I care for you, and I don't want you to do something when it's not the right time. That I think it's usually received pretty well.
Yeah. Now that we have effective treatments for obesity, the GLP1 agonists, people are, in my practice, we found these to be remarkable tools. I mean,
great.
we're using them, thoughtfully. We're in combination with a healthy lifestyle approach. We're not maximizing the dose. We're using just enough to get the results. But still, people, I have patients who are, losing 30, 40 pounds is Pretty common. I have patients that have lost 80, 100 pounds as well. One of the things, though, is afterwards people say, gosh, I have this loose skin, thing. And I've really struggled with, what to tell them. So I guess I'm going to ask you two parts. One, is there any advice you give somebody who is starting an aggressive weight loss approach on maybe minimizing that, and if there's anything? And then number two, what's the options for them if they've worked so hard, they've lost that weight, now they have skin that they're not comfortable with?
Yeah, so there's not much they can do to protect the quality of their skin. A lot of that has to do with genetics and your age and how big you were and how stretched out your skin gets. So most people who are losing weight start to kind of panic, like, I'm just going to have more loose skin, and I'm like, listen, lose all the weight that you need to lose. Don't worry about the extra skin. We can take that off if that's something that you want to do later, but I would rather you just go gangbusters and get to where you need to be in life to feel good and be healthy, and then we can address the skin. So it's hard. I don't have an answer for people to tell them, like, do these things and you won't have saggy skin, because everyone's skin quality is better. And then the options that are there for them are a little bit frustrating, right? Because it's very expensive to have these procedures, and insurance doesn't really cover these because they see them as cosmetic. Sometimes they will. And so they can obviously have skin reduction surgery. There's multiple different ways to do that for the arms, the thighs, the tummy, the breasts. We could do all those things. And so I would tell people, just go have some consults. Like, when you get close to that time, use this as an experience to just go interview some people, get an idea of what the different options are out there. Get my book, because I talk about all this stuff in it, and just make sure that you really survey all your options out there before you make a decision.
Yeah, I love that. I tell patients all the time, like, no good doctor is opposed to you getting a second opinion. Like, if I ever have a patient say, you know what, could I talk to somebody else? I'm like, yes, go talk to somebody else, because the joke among cardiologists is you ask 10 cardiologists, you'll get 12 opinions, about that. But it's biology is complex, and it's humbling. We all know that as clinicians, and there's different approaches, and what's right for each individual. It's not a cookie cutter algorithm to those decisions.
I think GLP-1s are great. I think that we're going to find that microdosing is going to be a big thing, and it seems like there's a lot of big things on the horizon with neurological diseases and possibly. I mean, I've talked about this. I'm friends with a doc who she uses a lot of microdosing GLP-1s in her practice, and she had her husband on one, and he was like an alcoholic, and he had no desire to drink anymore. Yeah. So it's really interesting, the central brain aspect to GLP-1s. And personally, I would rather patients get on a GLP-1 than to go have a gastric bypass. The potential risk of that operation is very high, even though they do it all the time. Yeah. I would rather them try a GLP-1 before they think about something like that.
Yeah. No, you're exactly right. I mean, I saw that in, my practice when I was back in the hospital. People that are 400 pounds type thing, like in surgery, it's a risky procedure.
Very.
Things I remember very distinctly. A young woman in her 20s, and she was morbidly obese. She had a post-op complication, but nobody could figure out what was going on. I was consulted as a cardiologist because her heart rate was 160, and I was telling them, look, her rhythm is normal. There's something driving this, and unfortunately, she ended up having a surgical complication that was disastrous. So you're exactly right. I mean, there's no free lunch in any of this. There's potential adverse effects, but the GLP-1s have been very exciting, and I'm very intrigued by these pleiotropic, I guess, effects of these GLP-1s, and decreasing inflammation. There was a New England Journal of Medicine article where it was people that are obese. They were looking to have knee replacement surgery. They randomized them GLP-1 or not. Of course, they'd say people that got the GLP-1 didn't have as many knee surgeries. Well, of course they lost weight, but it was independent of weight loss. So, and as you said, the early data on decreasing in cognitive decline in Parkinson's patients, the decrease in loss of brain volume in Alzheimer's. I mean, it's early, but oh my gosh, it's exciting.
It's
stuff.
really cool. I think there's gonna be some neat stuff.
And we're only on the 4th generation of these GLP1s.
Yeah.
I mean, I think there's hundreds of them coming.
Probably.
So who knows where that world is going to go?
Yeah.
For sure. The other thing I wanted to talk to you about, you have an incredible following on social media. Like, the real TikTok dog, that is your title. How did you get started in that?
Oh, so in 2016, I had a herniated disc, and so I had to have a quick procedure for that. And at that time on Instagram, I had someone in my office running my Instagram. And at that point, it was like no one really knew what they were doing. They were posting memes and stuff, and we weren't really doing anything with it. So I realized that our page just wasn't really doing anything. So I started to look at other surgeons' pages. I took over, started kind of posting stuff. And then things just kind of took off. Instagram got really hard. It got really hard to grow on Instagram, and it still is. And that was right around the time, do you know what Gary Vee is?
Oh, yeah.
Yeah, so Gary, this was around the time about 2019 when Gary Vee was like, get on TikTok, get on TikTok, get on TikTok. And I was so fed up with Instagram that I was like, let me go check out this TikTok thing. And there were a few doctors on there in 2019, like late 2019. So I started making content, didn't really know what I was doing in the beginning. Kind of watch, like Gary says, watch, absorb, see what other people are doing, but there weren't many doctors. And so I slowly but surely started to build my page. And eventually, I think after a few months, I was at like a couple 100,000, right? And on Instagram, I was at like 50,000. So I was like, wow, this is pretty crazy. So the TikTok reached out to me and said, hey, we'd love for you to be a part of our creator program. I'm like, well, what does that mean? And so they were like, well, basically, we will have a contact for you at TikTok that you can call and work with, and they'll help you grow your page. And they verified me at that time. And so I started working with someone, and I asked him one day, I said, hey, I've seen a couple of interventional radiology guys with blood, like doing some procedures. Like, are we allowed to show surgery? And he was like, yeah, I mean, if you're not showing nudity, like there's no problem with graphic content. So I started showing tummy tucks, and here's how you do a rectus diastasis repair, and just bringing people into the OR. I was like, this will be cool. I get to show people surgery. And so those videos were getting 10 million views, 5 million views, 2 million views. People were just so intrigued by how we put a breast implant in, how we do a tummy tuck, and my page just took off. And it took me about a year, I got to 1 million, and in another 2 months, I was at 4 or 5 million, and things were just taking off hard. And then they put a screeching halt on graphic content around 21 or so, and that's where my page kind of like leveled out, and it's just been sitting where it is now for a while, and I grow a little bit. But that's how I got involved. I was like, this is so cool. I get to bring people into surgery and just show them what we do for a living.
Yeah, I love your content because it is attention grabbing, which of course you need. If you don't have an ability to get eyeballs on it, then it doesn't matter how good it is. But you're drawing people in, and then you're delivering real value. Like, I see the message you have, the good you're relaying in that. Can you talk a little bit about your content? And
yeah, so it's evolved over time. In the beginning, when they sort of cut the graphic content stuff, I was trying to figure out, like, how am I going to capture people, right? People's attention spans are very low, and a talking head video of me just sitting here and talking about, the 5 things for breast surgery or this or that is not going to grab people. So that's when the reaction content started to come. Me and a couple other docs kind of started doing that, and we would take one video that would pull people in, and they would use that as an educational opportunity to then make a quick clip afterwards and teach people about stuff. So on Instagram, still cosmetic procedures are basically pushed down. So that's why I don't post a lot about plastic surgery, is because they don't feel that the younger audiences should be hearing about cosmetic surgery or cosmetic procedures. So I've just been kind of doing a lot of this reactionary content, since I'm general surgery trained as well, and I can talk about other things, to just draw people in and educate them. Because if you don't entertain people to a degree, no one's going to watch it. Their attention span's very short. So that really is where that came from.
How has your explosion on social media affected your practice?
Oh, it's been amazing. I mean, I tell people all the time, like, we generate several $100,000 worth of surgery every year easily. I mean, people DM me all the time to ask me questions or to tell me, hey, I'm having my last kid. Like, I'm only coming to you when it's time. I want to have a consult with you. So it's really positively impacted my practice. And as you know, not everyone's good on camera. For me, it's just easy to be me. I'm myself, and I'm not hiding anything from anyone. So for me to be able to show people my authenticity, to kind of show people, look, I'm a regular guy just like you. Like, I go out on hikes, I have a wife, I have kids. I try to show a lot of that stuff because it just normalizes me as a person and doesn't make me seem so scary as a doctor. And so I think if I was going to give anyone advice that's getting into it, it's just don't be afraid to just show your life a little bit. You know, you don't have to show everything, but you got to show your life. And so for me, that has drawn people into my practice because when they come to see me for a consult, they're like, wow, you're exactly who you are on camera.
Yeah.
You know, which is really, it's nice to hear that.
That's a really powerful lesson. You know, there's a lot of people who think that success on social media means renting the mansion, renting the Lambo, you know, putting the picture up out there. But you're right. It is your genuineness, your authenticity that is really drawing people to you. And, you know, one thing that, we shared when I first met you, we were talking about our children. And, you know, and I, of course, connected right away to you because you said, well, I have children on the spectrum. And I said, me too, you know, and so we had that. But it made you human to me because I will say, like, you're the real TikTok doc, right? Like, I don't know, can I approach this guy? Can I talk to him? Right away, you're just like, hey, man, here's my life. You know, I'm a regular guy as well. I found that to be very powerful.
You're not the only one to say that, and it makes me laugh every time that people are intimidated or look at me as like this big thing because I'm like, I'm not that great. Like, I'm a good guy just doing what I do in life, and I hit a good soft spot on some of the social media, you know, at the right time, doing the right thing that kind of helped me. So, but again, I think just being real is what it's all about. You know, we're just two guys trying to help people.
Yeah. And I love that you've taken that. You're humble. You're saying, I was just in the right place at the right time. Okay, there was some good fortune in that, but you've taken that opportunity and you've done good things with it. Like the great sage Spider-Man says, right? With great, response, with great.
I forget what he says.
Yeah, I know. With great power comes great responsibility.
That's right.
Thank you.
That's
yes.
right.
Damn, I messed up my Spider-Man quote.
It's all good. We forgive you.
But you've taken that opportunity and turned it into good things for people.
Yeah, for sure. I mean, look, I recognize that while everyone talks about how bad social media is, if you're not using it in your business, you are missing out and you are losing, and the world is leaving you in the dust.
Yeah.
Because it is free advertising for the most part. It's your opportunity to show people who you are and what you do. And so if you're not taking advantage of that, I think people are missing out.
Yeah.
And while there is a lot of negativity with social media, I keep it positive. I don't engage in the crazy political stuff online. I don't engage in negative comments on my page. I just let it be what it is. I show people what I want to show people. And if they want to watch it, they watch it. And if they don't, they can follow someone else.
Yeah.
That's kind of my attitude.
Yeah. What would you say to somebody out there who is maybe not happy with their body in whatever aesthetic sense, but they're embarrassed. They're like, oh, I don't want to be that person that goes and gets a plastic surgery, thing. I don't want to be seen as vain. I don't want to be seen as I don't want my friends to know about something like that. What would you say to somebody who's out there thinking about this that maybe really thinks that this could improve their life, but they're afraid to take that step?
I think you just got to go talk to people like me. You just got to take the plunge and go for a consult. I think that's the biggest thing. Is it's hard for people to find a good surgeon nowadays. They don't know who's good and how to find them.
Right.
But I think that the first thing I would tell people is it is okay to want to do something. I had a rhinoplasty when I was 24. I'd like to do my upper eyelids. It's okay to want to do certain things to stay looking youthful. We're lucky if we get to age, is what I tell people. You're going to get older. And if you do get older, it's a privilege, right? But if there's things that you want to do to kind of slow that process down that are reasonable, and it's something you can afford to do and you want to do it and it's right for you, go talk to some surgeons and just discuss it with them. Like, am I crazy? Is this something that I could do or should do? But you just got to be bold enough to have the conversation.
Yeah.
Yeah.
I like it. You've mentioned this several times throughout the podcast, is go talk to several people. You're not, and I think that's one of the things people get concerned about, is that they're going to go see somebody, they're going to get the hard sell, or I mean, the worst thing, I really feel for these, because I've seen this in among the celebrities that they go out, they take that leap to get the aesthetic procedure, and they look worse afterwards than they did before they went into it. I can see how that would be. I mean, that's just a terrible outcome.
It is. It's hard. It's such a hard business because there's so many non-board certified plastic surgeons doing stuff. And that's not to say that some of them aren't good surgeons,
right.
but they haven't done the training. They haven't done a plastic surgery training program. And so a lot of people get caught up in that cosmetic versus plastic surgery distinction, which is another conversation for another day. And so I think it's just hard to find good people. And so for that, what I would tell people is, talk to your friends in your community. Talk to people who've had plastic surgery. Ask them what their experience was with their surgeon. Do they like them? Do they not like them? Who did you see when you went to interview docs that you felt like you vibed with? And so that's another thing I would tell people. At the end of the day, I don't want someone to come to me who doesn't feel comfortable with me.
Right.
And I have to feel comfortable with them. We're interviewing each other. So when you go to see your surgeons and to talk to them, you should leave with a general feeling of the staff was awesome. They like the surgeon. They seem to appreciate him or her. I totally dug the surgeon that I talked to. I felt comfortable. I didn't feel judged. You need to make sure that those are the things that you're feeling, because I cannot tell you how many times patients have come to me who've been botched, and for me to kind of help fix whatever happened, for them to say, yeah, there were one or two red flags that I wasn't sure of, but like, my friends had great experiences, so I just did it.
Right.
And that's something you have to listen to, that gut feeling.
Yeah. Well, this has been an incredible conversation. I want to wrap up. Are there anything in this field that you're really excited about that's coming? Things that you see in the future that you're excited about in plastic surgery?
I mean, look, I think AI is pretty crazy, but I think it's going to help us in a lot of ways. I think we're going to be able to utilize AI to run our practices better in general.
I do too. Yeah.
I think that AI shouldn't be such a bad word as long as you're using it ethically. So that's one thing. I think GLP1’s are something on the rise that's great. In plastic surgery in general, I just think the way that robotics are changing and coming into their own is going to be even more efficient and better for like breast reconstruction and flap procedures and microsurgery. I think there's a lot of stuff coming down the pipeline for that. But I have to tell you that in general, bread and butter plastic surgery is pretty much like the procedures are what they are, and there's little innovations here or there. I haven't heard of anything new and crazy, but I would like to see scarring tackled on a better front. It'd be nice to see us to make way in that, because hypertrophic scarring is really tough for a lot of people. But and then the other aspect that I'm trying to start is to get every plastic surgeon in their office to start talking about mental health, nutrition, exercise as part of their practice, to integrate that into their practice so that they tackle those things before they start cutting on people. Yeah. So that's just something that I'm passionate about, and I have a wellness concept that I'm trying to start that centers around that process. Like, hey, I've identified that you're not ready for surgery, And so rather than funneling you and telling out to other people or telling you to go find people to help you lose weight, I'm just going to funnel you down my process. I've got a mental health specialist that can talk to you about your body image issues or food addictions. And I have, someone who can work on your nutrition with you and someone who can help you with your exercise. So I want to integrate that into my practice where I create this vibe of just a 360-degree approach where if you're not ready for this, then we have services for you over here.
Yeah.
And if you don't ever come back and need surgery, great. You've saved yourself an operation. So that I would like to see in the future, that kind of thing be more integrated into most people's practices.
Yeah, that's just going to be better outcomes for your patients.
For sure.
It's medicine tends to be very siloed. Well, I do this, and if you don't want that, you need to go somewhere else, and I don't know where to send you.
Right.
And you're recognizing that and filling in the gaps, man. Yeah. That's really awesome. Well, I know a lot of people listening to this are going to say, okay, I'm thinking about seeing Dr. Ricky Brown. Where can they learn more about you? Where do we send them?
So I'm sure we'll give you all the social media handles, but if you go to Dr. Richard J. Brown, that's my Instagram. You can reach out to me there. Obviously, our website has a contact info on there, and we've got kind of a newer system now where literally our phone number to our office, people can just text that, and my staff gets it. So if they're like, hey, I'm interested in a consult, just text our office number, 480-947-2455.
Wow. What a cool
and
thing.
my coordinator gets the message. The next day she goes, I got your message. You want to make a consult? Let's get you in. So Instagram is probably the one place where they can get me to answer a DM. Most of the other platforms, I don't answer DMs because it's just too much.
Right.
But they can reach me there, and then we'll put all the other platforms, I'm sure, on your
yes,
podcast.
Absolutely. Thank you for joining us.
Thanks for having me.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.